wasn't just a number to them. I was kin.
To sit here today and say we made it through and we wouldn't have changed a thing.
We went straight to the emergency bay at North Memorial. I don't know if we would have gotten the kind of care anywhere else.
That's exactly it. That's the difference here. You have been somewhere else and you came here. I don't think you can not notice that difference. But you're going to get everything we've got.
Very much a can-do attitude here.
You know, when I get here, you're kind of a pretty important person.
Hi, Nick.
Hi, how you doing?
Hi.
They don't come in with a diagnosis of heart disease or cancer. They come in with a name, and they should be treated as individuals with a name.
You guys are different. They know what. No one read the directions.
I actually ended up having a series of strokes. I ended up spending time on life support. Fortunately, I was at North, and they have the capabilities to do some really cutting-edge medicine, especially in terms of stroke care.
I think it was surreal. I don't think that I could really grasp what was going on.
Hot caution.
When there is a major healthcare crisis, it doesn't happen to one individual. It happens to a family.
The goal wasn't for her to walk or for her to do anything. It was just to keep her alive and just to not have to worry about not having a mom anymore.
Competency is assumed. What they get at North Memorial above just the competency of the medical staff is the care and the compassion and the empathy that the nurses and the physicians and the whole North Memorial body and family gives them.
But even the person on the housekeeping staff knew me. And that really mattered. That really meant something to me.
It's a community. There is love here like you wouldn't believe.
We were going south on Highway 100 and we got to France.
And I even remember asking him the questions about who did he speak to, and I remember being annoyed that he wasn't answering me, but apparently he was.
And I looked over at her and I saw the left side of her face just drop. Yep, I'm going, okay, I'm gonna have a handicapped and potentially brain damaged wife and 3 young children, including a newborn, and how am I gonna do all this by myself?
It's that human touch, it's that human connection that we say, we care about you as a person, we care about your family.
Don't get money. I didn't know that North Memorial was the #1 stroke center. I'm glad it was.
Treatment to me implies medical care. What do we do for your pneumonia? What do we do for your fractured bone? But how you're treated, in my mind, is us going beyond their healthcare necessities.
Hi, Heidi. Just checking back to see how you're doing with your pain and your nausea.
The staff was amazing because I was scared. I was away from my family, and the staff was really willing to be accommodating for that.
Hi, how are you guys?
And very grateful, not just me, but my family as well. Because when you have 3 kids depending on you at home, that's important that you have doctors who are willing to go above and beyond.
Thank you.
A group hug.
A group hug. Oh.
We really develop a relationship with them, so beyond just delivering the service that's expected of us and doing it in a high quality way.
Does that hurt? Stomach kind of?
Are we really engaging with patients in a way that helps them heal, makes them part of the process, ultimately developing a relationship with that patient and their family?
In April of 2014, we were about halfway through our pregnancy with our second child, Anne. After meeting with doctors and specialists, we found out that Anne was diagnosed with multiple issues that would not be compatible with life.
Your world's turned upside down. You've just been told that your daughter won't be able to survive.
We met someone by the name of Sue Steen. She really became vital in our experience with having our daughter and preparing for both the birth and death of Anne.
The staff are phenomenal here, and they've been educated and are committed to really giving this family what they need during a really difficult time.
She treated us like family, basically, and when you're going through something so difficult, it was imperative that we had someone that we could trust.
Anne was born and lived in this world for just 1 minute.
We spent 2 days with Anne. She was born on a Tuesday, and we were with her through that Thursday, and that was all at Maple Grove Hospital.
There she is!
Jack had just turned 2 when Anne was born. I think Sue especially and the nurses there really helped us to normalize it with Jack and for him not to be afraid of his sister. This is a doll that Anne gave to Jack.
Here comes Anne, you ready? Can you picture?
To this day, Jack loves having his Anne doll, as he calls her.
We have nothing but love, certainly for the people who took such great care of us, and something we'll remember for the rest of our life.
Where are we going, Captain Jack?
They know us, they understand our story. As much as they are family, this is just the next step in our journey.